Parents, wouldn't it be great if going for a dentist appointment was exciting and pleasant for the kids? Well, there are things that can make that trip actually fun.
That's right, including smiling faces that greet you and a dog. That's right, I said a dog. Just like Jessie, who actually joins us this morning along with Dr. Angela Wolfman. Angela, thank you so much for joining us.
Oh, you're welcome. Thank
Jessie.
you for having me.
Jessie, too. I don't want to leave you out, Jessie. You are just the sweetest little thing. So, Angela, let's start by talking about maybe the difference between pediatric dentists versus general dentists.
Sure. A pediatric dentist is a specialist that has gone on after dental school to do 2 to 3 years of additional training. So we are like the pediatricians of the dental world.
That's a good way to use an analogy. And so when is actually the first time you should take your child? Because I'm sure that's kind of a question you get a lot.
Yeah. The first time you should take your child to a pediatric dentist is by age 1. Or 6 months after the first tooth comes in, which is usually around age 1. Okay. The American Academy of Pediatric Dentistry and the American Academy of Pediatric recommends that you establish a dental home very early. The reason for it is because having cavities or dental caries is the second most chronic disease in children, and it can be prevented by starting early.
Yeah.
Yes.
So it sounds early, but it's not too early because
no, it's not. It's not. And the first few visits are meant for the parents to educate the parents, give them tips on how to prevent cavities, identify risk factors. Because once those risk factors are eliminated, then your child is less susceptible to getting cavities.
Absolutely. Well, I don't know about you, Tina, but I have a lot of friends that kind of have anxiety about going to the dentist. I mean, some that are outright frightened. So we obviously want to start our children off without that fear. So do you have any tips for parents?
Yeah, there are a lot of tips out there. I think one of the easiest things that parents can do is get a book. And there are lots of books out on the first visit. Read through those books. Familiarize your child. At our office, we also give complimentary tours. So you can bring by your child and get a tour, and they can see the environment, meet some of the team members, and just feel at ease. I think that helps. And most pediatric dentists, what they do when you come into the office is they'll utilize a routine called tell, show, do. So we talk about it, we show the child what's going to happen, and then they do it. So it really lessens that fear.
And I'm taking a wild guess here, but I'm assuming Jessie greets as
Jessie does do her fair part.
I'm sure that's a calming agent.
Yes, she definitely is.
Bless you.
She doesn't smile, but she dances up at the front. So when the kids come in, they're like, wow, you have a dog. And, you know, it just kind of puts them at ease a little bit. And we also use Jessie as a reward system. So if they've taken their x-rays or they did great, they're like, can I see Jessie? And we're like, yes, we got to do this first.
Yeah.
I would like that
motivate.
too.
Yeah.
Tina would be at the dentist every week if this was
Sorry.
We have a lot of parents asking to come in.
Yeah, I think that's great. So Angela, kind of talk us through what a normal, typical visit would be like at Great Grins.
Sure. So you walk in through the doors, and we have a lot of bright colors and lots of things on the wall. And usually one of our team members is right there to greet you, along with Jessie. We always run a contest or something, you know, tickets to the U of A game, guessing games, so the kids know about this. And that's the first thing. They're like, what do you have going on now? And so they sign up for that. And then we emphasize routine in our office. So the kids know what's going to happen. And I think that's what really puts them at ease every 6 months, coming in all the time. They know how their teeth are going to be cleaned. We take them back. They get to pick out the flavors. It's almost like a restaurant, like an ice cream. They get to pick all these amazing flavors. You know, just the other day, I had a parent that has been coming to us for years, and we were talking about her little boy. And when he first came in, he was so scared, wouldn't look at us, wouldn't do anything. And now, you know, through the years and these routines and making everything positive, he's great. He's gotten x-rays, he's been in the No Cavity Club, and I call him my little dental model. You need to model for other kids.
Yeah.
And that's what we like to stress in pediatrics, is just making it positive, making it fun, but also keeping them cavity-free.
And you're implementing something that they'll continue for the rest of their life. They'll
Of
just know
course.
going to the dentist is
Yes.
something you do from here on out.
Yes, you can't avoid it.
Exactly.
And you need your teeth the rest of your life.
Exactly. And so really quick before we end now, I kind of am curious, why did you choose Tucson to set up as the place to help everyone?
I think this is a great city. I mean, it's a city, but it feels like a small town.
Yeah.
It's a great place to raise a family. And my family moved out here. The mountains are gorgeous, and you can't beat the weather here.
Oh, there we go.
You said it.
I think this is great. I think Jessie is amazing.
Yes, she's great. She provides a very nice environment.
Well, you guys do a great job of keeping the kids happy and, stress-free, and I'm sure that relays over to the parents as well. So, Doctor,
does.
thank you so much for coming and talking to us.
Thank you for having me.
Oh,
My pleasure.
absolutely. You can visit with Great Grins at the Mix FM Baby Fair, actually, on August 8th. For more information, you can call 325-GRIN, that's 325-4746, or log on to greatgrinsdds.com.